If the patient comes back with no change, or the patient comes back being worse, for instance, then we go back and reevaluate. And I am a physical therapist as a background, so I reevaluate always first my mechanical measurement. I go back, start re-questioning the history, retesting, making sure, do I have the right hypothesis to work with, etc. Other things that I have, overlooked or misunderstood or something like that. And if it comes that, no, I'm quite certain this is what is going on, then we together evaluate their measurement on the well-being, the measurement on our alliance, the measurement on the self-management strategies. And there is, if you work, for instance, with the well-being and the positive psychology in that, there is a cutoff score. I mean, you have 4 questions on a 10-centimeter scale, means that you can get a maximum of 40 points, 10 points for each question, okay? And research shows that an average person with a well-being level scores 25 or above. So if you score below 25, that actually means that the situation the person is in or the problem that is bothering the patient is taking a lot of mental capacity. And that may mean that the patient doesn't have the resources or energy to change behavior or to deal with new issues. So that is a very strong tool for you to work with, because you can have all the right biomechanical diagnosis and exercises and posture corrections or joint mobilizations that will work for your biomechanical problem. But if the patient doesn't have the capacity to funnel up on that, then you're getting nowhere. Then you need to go back and look at the well-being and see, is there anything we can address differently here? And the measurement or also the research on that shows that if the patient scores below 10 on the outcome rating scale, that could mean that the patient is suffering from a severe depression or is suicidal. So that could mean that you need to, to refer the patient to other, like psychologists or back to the private practitioner or stuff like that. But not always. You just need to be aware of resources that the person is dealing with.